Good afternoon, everyone, and welcome to Making It Even Easier for GPs to Empower Their Patients. This is a collaborative session today with ourselves, Elemental, our partners, Vision, and our customers, Salford Primary Care together. I'm just going to give it a few minutes, just in case there's anyone coming on a couple of minutes late. I hope everyone's doing well today. The sun is shining here in Derry anyway. I'm hoping it picks up. We were supposed to have some rain, so hopefully the sun stays for the rest of the weekend. We'll just get a few more joining and we'll kick off in a couple of minutes. Okay, everyone. So once again, welcome to Making It Even Easier for GPs to Empower Their Patients. As mentioned, this is a collaborative session this afternoon with ourselves, Elemental, our partners, Vision, and our customers, Salford Primary Care together. My name's Serena Terry. I'm COO at Elemental, but I'm also your facilitator for this afternoon. And I'm just going to go through some housekeeping with everyone now. I just want to make sure the audio is okay and you can see my screen. If that is the case, as demonstrated in the image to the right-hand side, can you raise your virtual hand for me, just so I can make sure everyone can hear me, everyone can see my screen? Perfect. There's the hands going up there. And if at any stage throughout the webinar this afternoon you'd like to ask us a question, please feel free to pop your question in the questions box on the right-hand side. We will stop regularly for Q&A, but if we don't get to answer your question today due to the number of delegates online, we will follow up over the next few days via email with a response to your query, but continue to ask questions throughout. We want this to be nice and engaging. So what are we going to cover today? So in today's session, we're going to kick off by a high-level overview of what social prescribing is and why it's important. We're then going to lead on to how digital is supporting the measurement and scaling of social prescribing. And then we're going to talk about the benefit and the value of the Vision and Elemental partnership. We've then got the lovely Dawn Jonks, who's team lead at Willow Tree Healthy Living Centre, who are a partner of Salford Primary Care together, and she's going to talk about Elemental and Vision in action. We'll then run through a few benefits for your organisation and how your organisation can benefit from this partnership and digital social prescribing. We'll then follow up with some steps for what's next and how you can get started with Elemental and Vision. And then at the end, we'll do another Q&A session. So without further ado, I'd like to introduce you to your hosts today. And if GoToWebinar and technology are on my side, I should be able to show you these lovely ladies on the screen as they are right now. Give me 1 second, because look, they've done their hair and everything and they want you to be able to see them. So give us the wave. So we've got Jennifer Neff. She's co-founder and co-CEO of Elemental. We've also got Lisa Holden, who's the Vision Partnership Manager. Hi, Lisa. And we've got Dawn Jonk. Dawn is actually on annual leave, and we're so glad that time out to join us today. She's team leader at Willow Tree HLC. So ladies, give us a wave.
Hi guys.
Hello everybody. Hi.
Hi.
Alrighty. So without further ado, I am going to kick off our first poll. Now, the reason we do a poll this earlier on in the webinar is we like to set the context and set the scene for the webinar. We do want to talk about social prescribing, but we're conscious that not everyone is fully involved in social prescribing. You might be at different stages of the journey. You might be a GP in the practice that hasn't got anything to do with that side of things, but we really just want to kind of set the scene and see in terms of what stage of the social prescribing program is your organisation at. And we want to ask, how digitally mature is your social prescribing program? So I'm just going to launch this poll now. And if you have a look, there's 5 different options. So maybe your social prescribing program is still in its infancy. It's pretty ad hoc, paper-based. It might have moved on. It might be organised. Might be largely paper-based still, but you do have a local directory of services and there's signposting that goes on there. It might be that it is just a directory of services that you're signposting to, or you might be moving up that level of digital maturity that you've got a social prescribing platform in place. You've got some interaction with systems, or you're leading the way and your social prescribing program's advanced digitally. You've got full integration, full reporting capabilities, and a platform in place. So we'll just let that run for a few minutes, and then I'll share the results with you so you can see in terms of the audience today what level everyone is at. I'll just give it a few more minutes there. So it might be hard to answer if you are essentially a practice manager or GP manager that's not involved in social prescribing. So you don't have to want to, but if there is something that closely resembles where your organisation is at, it would be good if you could pop that in. So I'm just going to close that poll now, and I'm going to share the results. So we have a kind of even keel there around level 2, level 3, and level 4. Jennifer, 26% organised, largely paper-based, 26% standalone directory of services, 26% social prescribing software in place and some integration, and then 12% evenly across from level 1, ad hoc paper-based, right up to that advanced. So it's pretty diverse in terms of answers there. What do you think?
Yeah, that's great. And I suppose it's maybe not a surprise because people are at different stages in their social prescribing projects in terms of setting up or rolling out, or a lot of people now have been doing it for a number of years and they're scaling social prescribing across their primary care network or their CCG area or their ICS area. So yeah, look, that makes perfect sense. But it's good to see, Serena, kind of where people are at and where they're coming from, because I suppose social prescribing has been around for so long now that it is, and we see it more in policies and practice and all strategies and things like that, that it does stand to reason that people are at different stages, but that they are starting now to think about, okay, it's worked really effectively in this particular neighborhood or in this particular community. How do we scale this best practice? How do we better connect in the other stakeholders? Because as we know, it's not just GP led. There are so many other health and allied health professionals involved. There's social workers, multidisciplinary teams, housing officers, local authority staff, you know, paramedics, everything. It's been more widely adopted.
It's really good to see that. It's good to see a good mix of maturity in relation to what stage people are at in their programs. So thank you very much, everyone, for giving us that insight. As I said, it's nice to set the scene and make sure that we're covering all bases for all different levels of digital maturity. So we'll just hide that poll now. I'm going to hand you over to Elemental CEO and co-founder Jennifer Neff.
So hi everybody, and I always like to say thanks at the start of these things, because you're giving up your time, and you've probably had lots and lots of different Zooms and webinars happening. So it really is a privilege for us that you've tuned in today to hear about what we're doing, because we're really excited about this. So just to set the scene, obviously, you know, we've seen from the poll, everybody knows what social prescribing is, but this is kind of our definition of it. So Leanne Monk and I set up Elemental, I can't believe it's actually 7 years ago, and it was all about connecting people into their own communities. Now, we didn't know that we didn't know about social prescribing at the time, and then someone one day said, look, what you're trying to do, everything that you're talking about here, it's actually, there's a movement, it's called social prescribing. So this was 7 years ago, and Leanne and I looked at it and we said, oh, that's exactly what it is. It's connecting people into their communities, but it's understanding the importance of a middle person, like a link worker, a navigator, a community developer. And we knew from our backgrounds in community development how important that role was, but also how challenging that role was. And I'll talk through some of the challenges a little bit later on. But yeah, so it's essentially about connecting people into physical activity, diet, nutrition, but it's also acknowledging that, you know, if people have debt issues, debt-related issues, housing-related issues, social welfare, legal advices. These things are so important because you won't be up for participating in the diabetes prevention program if you're worried about potentially losing your home. So this is why it's so important. So we set out at the start on this quest, and it was like, we're going to make this easier. We know this works. We know social prescribing works because we've been in it for, I think both of us were about 15 years in it, in the front line side of things. So we said, look, digital has a role to play in this. It can't be the dominant force, but it definitely has a role to play. Let's explore what it can be. So Leanne and I kind of set out, and we listened to people and talked to people for 2 years to find out, what needed to happen. And Elemental was born from that. So we're going to show you a little bit later on kind of how this works in terms of this partnership. You'll see a little bit about what Elemental does as well, and it'll give you a good overview in terms of where we've come from, what the system does, and what it now does with Vision, which is great. So moving on, we all know that there's lots of different component parts of social prescribing. There are so many that, and you need so many different people for social prescribing to work, for people to be connected in to their communities. Oh, I think I might, Dawn, have you got maybe get Dawn to put or mute on? I think there's a little bit of background noise. I don't know if she hears me. That's grand. Sorry. So it's really, really important because we know when social prescribing works well, it promotes better partnership working. So COVID's a great example, because there was these partnerships between these different agencies and relationships and partnerships between organizations. It means things can happen more easily. You're not sort of sitting around and there's not kind of red tape in place. You're able to mobilize things, make things happen quickly. We also know that social prescribing plays a significant role in the reduction of health inequalities because of the importance of addressing those wider determinants of health. It impacts on obviously population health, and population health is that space where data meets reality. And that's kind of where social prescribing is sitting. You've got this data, but you've also got what really happens on the ground, and that's an exciting space to be in. It provides a co-designed pathway, and patients really can determine, they can say what matters to them in social prescribing. They can say what they like, what's helped them in the past, what they don't like. And then that's where that pathway can be really designed with that patient at the centre. And that's really where kind of you've got your truly integrated health and social care systems that are patient focused. And finally, we know that social prescribing can really demonstrate the impact that the VCSE, the voluntary community, the social enterprise organisations make on prevention, on community health and well-being, because we know they play a massive role. And that's one of the big things for Elemental, was that we wanted to help demonstrate the role that they play and to show that, look at the difference that they are making, so that they can move away from just being funded year on year, that there's more sustainable funding. So there's a whole reporting element of Elemental that helps to be able to build the capacity of the community and voluntary sector and truly show the difference that they make. Just moving on then very quickly is, we'll be all familiar with the kind of journey through social prescribing. So we know that there's a referral made. It might be a self-referral, it might be made by a GP, it might be made by someone else, maybe a housing officer. We all know that, people say, look, this is our program, this is the inclusion criteria. We want to help older people, or this is a program for young families, or this is a program for people with long-term conditions. So everyone has different kind of inclusion criteria, and it's largely hopefully driven by the need in a particular community. Then you have you've got link workers. So sometimes you'll see part-time link workers. Could be a team of link workers. Sometimes they might even be called link workers, and they might be a social worker or a community development officer or a pathways advisor. But they are so critical to social prescribing, and we all know that. And it's about making things easier for them because they're under a lot of pressure, especially during COVID. So it's about making life easier for them. And that's what Leanne and I said when we first started out. We said, look, this is a really important role. We need the link workers to be feeling supported. And then you've got that opportunity to look at what's available in a local community. So with Elemental, we underpin this whole process. There's even a database of services on Elemental that a patient can say, I only want to do something within a mile of where I live. I want to do something that's free because I don't have a lot of money this month, and I only want to do something for beginners because this is a big step for me. So Elemental works with the different projects to be able to pull together all those assets and resources that are available and kind of categorize them into different things like diet, nutrition, mental health support. We even recently introduced a COVID category. So a lot of people now have new interventions that are non-face-to-face that are really important, like mutual aid, befriending support, grocery distribution. So this is always on Elemental, and then the link workers can then refer people into those things. Then the link worker does a lot of follow-up. So they might have done a little baseline assessment when they first chatted to the person. So a lot of people have different measurement tools built into their funding. So it's like they might use Swen webs, they might use the patient activation measure. This is kind of getting that baseline. How does this person feel right now? And then you can truly show then the difference that the link worker and the interventions have all had on reducing someone's anxiety, helping them feel more activated, feeling less depressed. So that's where that follow-up, and again, that can all be done in Elemental. So you start to see a little graphs and charts showing that distance traveled for that person, and the commissioners love that, and the patients love that too. A lot of patients like to see, look at the difference that this has made on my own health and well-being. I know I've enjoyed it, but I didn't realize that my anxiety levels were actually going to be dropping as a result of this. And then finally, then you've got the full impacts, because there's a lot more than just what is the difference that it's made on the patient. Whilst that's really important, we want to be able to see what's the provision in a community. You know, where do we need to put extra funding? Is there an area maybe that has an issue with lots of social isolation and loneliness? And are there enough programs and services? Is the sector sustainable enough to be able to support those people? And that leads me on nicely to the next slide, which is, you know, a lot of you'll recognize the NHS outcomes framework. What Elemental does is we're able to demonstrate the impact that your project has on the patient. We're able to demonstrate the impact it has on the community and to be able to help you future plan. And we're able to demonstrate the impact it has on the health and social care system. And obviously the funders and yourselves determine what that looks like, but we can support you on that. And then finally, from me at this point, I just want to kind of, and this is, I suppose, one of my favorite slides actually, is because what are the challenges that you told us about? So when Leanne and I spent 2 years out listening to people, and people said, would you ever get on with it and make it, or do what it is you're going to do? It was really important to hear what you guys were saying, and we're still hearing and we're still listening to what you say. And this is a little summary of that. So health and housing and social care professionals, more than ever, you're wanting to be involved in social prescribing, but you don't have all the time or the research activities to be able to see, you know, the capacity to see what's out there in the community. You're also kind of thinking, well, these are my patients. How can I make sure that my patient's going to be looked after if they're referred into a particular intervention? And then a lot of you say, I've made a referral, but I have never heard anything back from, you know, what happened. Did the person meet with the link worker? Did they engage in the service? So we listened to that, and we've this part of this partnership is demonstrating that we've listened to you on that. In terms of the patients, the residents and the tenants, they said, yeah, brilliant, you know, don't just hand us a leaflet, but because, you know, we're not really, you know, always going to be able to just pick up the phone and get the support that we need. We need a little bit of extra support. We need someone like a link worker who's going to help us, who might even go along to some of this stuff with us, because this is a big step for many people, and they want to know about what's happening in their community. I always think back to a time when Leanne and I were out chatting with a group of older people, and someone said, I didn't know there was free swimming classes around the corner on a Friday for me. So it's about making that available and making that knowledge available through someone that they know and trust, because we know that link workers have great relationships with their communities. Then you've got the community and voluntary sector providers. So they said, yeah, we don't always have the capacity to receive referrals, but we would like to be able to, you know, have the offer to be able to do that. We don't always have the time to write back to all of you and say, thanks for making that referral. This person, actually, it was anxiety, and I'm now helping them with their debt advice, and they're engaged at X, Y, and Z. So they're so pushed because they've got so much to do delivering the program, and then they're expected to do the evaluation, and they're expected to feed back to everyone and report on it. So we listened to that too, and we said, look, there needs to be an easier way for that to happen. And then finally, the health and social care commissioners and housing, they said, look, you know, we need the analytics. We need more than just bums on seat, more than just how many people attended. What difference did it make to people's lives? You know, what's now happening as a result of that? Is there less GP appointments, less A&E admissions? Tell us the stories about people who've actually their lives have been improved, but show us some of the stats as well. So that's kind of, that's really, I suppose, leads very nicely on to what this partnership is all about. I think it's Serena now.
Yeah, I'm just going to pass over to Lisa, who's going to give an introduction and a bit of background on Vision and why they partnered with Elemental.
Thank you. Hi, thanks everybody. So you've heard of Vision, but you may not know that we are part of the Cegedim Group, which is a huge global technology and services company that offers solutions across healthcare and health insurance and data management and pharmacy. And Vision is the primary care solution that is supplied to GP practices across the UK. Next slide. So I'm the partner manager and I look after all the third-party companies that integrate to the clinical system. And we're really pleased to be partnering with Elemental as we know that they are the market leaders in social prescribing. And we want to ensure that all our Vision practices have access to this so that they can achieve their local targets and objectives. And we're promoting this as our preferred solution of choice. So what we're going to show today is the phase 1 integration that allows a Vision practice to make a referral to Elemental. But phase 2, which will hopefully be early part of summer next year, will be to write back that encounter back to the Vision clinical record.
Thanks, Lisa. And this slide's really just, sorry, Lisa, that's for you now just to go over the kind of Vision footprint and give us a bit of background into who you're working with and where.
Yes, thanks, Serena. Okay, so we're now actually the only principal clinical system supplier that supports practices in all 4 countries of the UK. So it's really nice to see so many of you on the webinar today from Scotland and Wales and Northern Ireland. Jennifer?
Yeah, and then so this is we're just kind of showing the overlay here as well. So there's 11 hubs in Scotland. These are all the healthy living centres in Scotland as part of the Scottish Connected Communities programme and the Spring programme. Many of you might have heard of that. And there's 11 hubs in Scotland. They're healthy living centres using Elemental. As well as that, we are just recently in North Wales, Betsy Qualador University Health Board. So we're across 6 counties. I think 2 of them have just gone live. One is about to be announced today in Anglesey. But we're also in Cardiff and Vale University Health Board. I think there's a number of Southwestern GP clusters that we're with there. And we're with the United Welsh Housing as well. In Northern Ireland, there's 14 healthy living centres that are part of the Spring project, and they are based throughout Northern Ireland. So they use Elemental too. So they have access to Elemental for their Spring project and their healthy living centres. But then in England, there's actually 265 hubs across England. So a good example and a most recent example would be Greater Manchester Health and Social Care Partnership. They selected Elemental as their digital partner to roll out and scale social prescribing across Greater Manchester. So within those localities, there's 10 localities altogether in Greater Manchester. Many of those, like Bury and Salford, I think Bolton as well, are using Vision as well for their GP systems. So we are also being used in Greater Manchester too. So where you have the Vision GP practice and Elemental being used in the link by the link workers and the different community and voluntary sector providers, this is where this connection, this partnership is really going to make a difference. And we've got some little things at the end of the webinar just to talk about, if you're not already using Elemental, we've got some kind of calls to action for you. There's some extra support there to find out more about how we can help you. So now the bit that you've all been waiting for, the how does it work bit. So Lisa's going to lead us in on that.
Okay, thanks. So many of you will recognise this screen, and for those of you that don't, this is the Vision patient consultation view, where a GP would make a referral. So the first part of this integration is the GP would follow and do exactly what he would do as normal, which is add a referral. He would choose the relevant social prescribing read code and add a brief reason why he wants to make the referral. So when he clicks on OK, that's actually added to the patient record. So the exciting bit and where the integration happens is that over on the right-hand side, there's a new tab that's called Elemental, which if you guys can see me wiggling my arrow there. Yeah, there we go, right hand side where Elemental. So when the GP clicks onto that tab, you can see we're still inside the Vision patient record, but what's happened is it's launched into the Elemental portal, taken us into the new Express referral screen of Elemental, but it's merged through the patient demographic details of Aaron Jones in this case, and his date of birth and his NHS number. So the GP doesn't have to retype that in, that's all been brought through. So I'll now hand over, and that's it, that's the Vision part of it. Add referral, click on the tab. So I'll now hand over to Jennifer to talk you through the Elemental side of things.
Yeah, so just staying on that slide before, Karina, if you just pop back to that last one. The great thing is that you can see a referral, sorry, the next one. Number, yeah, that one there, yeah. So you can see here that there's been a previous referrals made, but on this occasion, it might be that maybe the patient, someone's recently passed away and they need some maybe bereavement support. So a new case is going to be made, a new referral is going to be made for Erwin. So if we go on to the next slide, so as Lisa said, it pulls across some basic demographic data. So like she said, you don't have to enter that again. You might just have to put in the phone number, and then there's the last two things that you're asked for is what's the reason for a referral. So there's a drop down menu for you to choose from, and where are you making the referral to. So a lot of people already have their partnerships in place with their local link workers. Your link worker might already be based in your practice, like in many PCNs, or you might have a good working relationship with a local community and voluntary sector organisation who you already have set up that they're going to be able to receive your referrals. So this is where you would, the drop down would say, you know, to the dairy hub or to wherever. So you're able to do that. And then the final little thing is just patient consent. So you're able to say to your patient, look, the information that you've shared with me today and your demographic details and the reason for referral is now going to be shared with a local link worker who's going to give you a call. Is that okay? So if the patient agrees to that, there's a little consent button that you press, and then that's recorded then as part of that referral that consent was obtained. So just moving on to the next slide then, so that you can see that's that referral made. It's made, and the person who's made the referral, the GP or whoever, can see that they made a referral on that date. The great thing is then that you can see when that referral is actually being received by the link worker, because the link worker does something on their side that triggers a little update so that the referral maker can see that, yeah, brilliant, I can see that that patient's now within 3 or 4 days or whatever of making the referral, that patient has had a call from the link worker. So just moving on to the next slide. And this is what the referral then would be seen in terms of the actual person who's receiving the referral. So the referral handler, the link worker, will get an email notification to say, log into Elemental, you've just had a referral. So there, as you can see, the information that Dr. Paul had put on his referral form. And yeah, so this now is the view from within the link worker's case. So the link worker can see now that they have the referral here. They can start to work through a process. You can see the little data and risks tabs. That's where the different tools are. So your SwenWebs and your GAD7 and your PAM score is all in there. Then your client social prescriptions. This is where that database of services is brought up, and the patient can choose what they want to get involved in. And then it's their appointment calendar. So it helps the link workers to really organize their schedules and their planning, and it sets reminders for them to get in contact with the patient again so they can do their follow-up visits. And the next slide is just, a lot of people like to see kind of what does it look like then whenever you've got all those different programs and services on Elemental. And it really looks, it's driven largely by the project. Some projects like to only maybe put 4 or 5 things on there. Other places like to open this up and say, look, let's invite everyone to see if they would be interested in receiving referrals electronically. Some projects just say, look, we're not actually going to give access for them to receive referrals electronically. We just need to note where the referral was sent to, or who the patient was prescribed or signposted to. But this is where someone has said, look, let's have all our programs and services on here. So you've got the domains down the left hand side. and it's all under the different headings of mental health and, you know, finance support or whatever. You've got the types of classes. Is there a cost? Is there not? Is it suitable for beginners? Is it more intermediate level? It's all geotagged as well, and people can actually rate the services to themselves, so they can say, look, the walking club, I found it really, really useful. When they're chatting with the link worker, they can say that was a really good service. I would, you know, recommend other people who maybe are starting out on exercise to be able to rate and get involved in that. So this is just to let you see what's on the other side. This is an elemental, but you know, it's a lot of GPs and other MDTs like to know, I've done my bit making my referral, but you know, what happens after that? So that's just to give you a little overview on that. So that's a little breather. We're just up to the halfway mark. I suppose we've shown you, we've talked a little bit about the partnership. We've shown you some of the slides to show you how it works and how to get set up. So we'd love to hear from you now in terms of any questions you might have at this point.
Yeah, we have a couple of questions in here, but if anybody else wants to fire through in now, please feel free to do so. Jennifer, I can hear one of your dogs barking there, so
It's
you're
not
probably.
actually. My two are sleeping here beside me, thankfully. It's somebody else's dog.
That was mine.
Oh,
He doesn't like the postman.
is that what it is? The postman. All right, just
Shut the door.
one from Paula Burns here. So I think we kind of went over this at the outset, but just to clear up any confusion, Jennifer and Lisa, is this already on Vision or do we have to sign up? That's a question from Paula Burns. And then Joe Smale is asking, can GPs access the social prescribing database on Elemental directly too? So do we want to cover kind of, again, in terms of the partnership, what needs to be accessed first?
Yes, that's a good point, and we knew this one would be probably need to be explained a little bit more. So thank you for those questions. So I suppose the best way to describe it is if you have, say for example, there's a social prescribing project and they're using Elemental already, and there's GP practices in the area that use Vision. That's the kind of easiest way, because you've already got your license for Elemental, you're already a Vision customer. And then we're able to take the details in terms of which practice and some, you know, just some practice details, and we pass that on then to the guys in Vision, and they do that activation piece for us. Now there's a little cost associated with that. It's not too much, and we can follow up with people afterwards if they want to know what that is. So that's the easiest scenario. But in many cases, you're going to have people who have Vision, but they don't have Elemental. So they say, right, this is great having this, but how can I access this? This is where we are able to follow up with you afterwards. We've done a special package for this that enables you to try this out at a lower cost than normal. And again, that's where we'd like to pick up with you. So what we would do in that case, we'd find out, okay, how many link workers are involved in your project? How many people are you got, you know, referrals have you got that you've got to make this year? You know, what does the referral pathway look like beyond, you know, once the GP has made the referral? So we would work with you together, but the package that we've got in place is it gives you a chance to get up and running with it and start to benefit from that connectivity between your social prescribing project and your local primary care networks. Lisa, do you want to say maybe anything else that I might have missed?
No, that was good. But yes, I will say a few things. As far as the activation bit goes, the tab that I showed you that said Elemental, that's the bit that we need to activate so that you've got that tab available for you. We've done some joint user assistance that's available in the Vision knowledge base, but we're doing it as a managed project with Elemental. So you place your order, it gets activated, and then Elemental will be talking you through the rollout and the training of that side of it. So no, that's why you don't have access to it right now. We need to enable that tab for you.
And it's worthwhile saying too, I think that, you know, there's a lot of commissioners out there. So a lot of people would say, well, you know, how can we make this happen easily? Most of our customers, it's all come through commissioners and CCG or GP federations or primary care networks and clinical leads. There's also NHS foundation trusts as well. So, you know, we are happy to, if you wanted to get a group of people together who you think might be interested, we're happy to go through and have a chat with everyone and show them the elemental system in more detail and kind of provide a quotation on that side of things. That's kind of what we do everywhere. You know, it's about really important to get that kind of all the stakeholders in the room initially to kind of to work through that together. So if anyone wants that to happen, just give us a shout. We've put some contact details up at the end.
There's a couple of questions in there. Sorry, Lisa. There's go ahead, Lisa.
I was just going to mention that on our Vision Partner page, for any Vision practices, you can click onto our partner page, go to the Elemental link and put your details in, and that will then be sent straight to Elemental so that they can follow up with you.
So there's a good question there from Sally Oakley, and Jennifer, you touched on it there, and she's asking, what if we don't have Elemental or Vision?
Oh, that's a good question. I don't know. Yeah. Well, what do you have? You might have a different clinical system. So yes, we can talk to you about that as well. So, you know, whilst we're here today talking about this very special partnership with Vision, there are other, if your GP practices use other clinical systems, we'd happily take another conversation offline with you about that. But we also have a portal that you don't even need to be able to use to make a referral. Now, it's a portal that you can give access to your paramedics or your GPs. It means that they'd have to fill out the referral form themselves, but it doesn't take that long. We have designed this system so that it is easy. So whereas with the integration with Vision takes literally 30 seconds to do a referral, we've looked at it, it's about 60 seconds if, for someone else to do that. So yeah, you know, you could say, look, we have people in the Jobs and Benefits Office, we have got housing officers, there's some social workers, there's some people in this particular hospital or whatever that you want to make referrals. That's not a problem at all. You can use the Elemental portal for that. Fill out your referral form, pop the details on there, and it gets sent over then to the link workers in the same way they're able to receive it. So it's not a blocker if you don't have a clinical system that you're using at all.
Thanks, Jennifer. And we've time for one more question there, and then we'll move on to the rest of the webinar, and then we'll come back at the end for a couple more Q&As. And again, if we don't get to answer your question during today's session, we will follow up an email afterwards. So Jennifer, Sebastian's asking there, does Elemental carry out quality assurance of providers?
We don't actually, but we'll help you. We'll talk to you. The first thing we'll ask you about that is, okay, what level of quality assurance do you require for your project? You might have already set some levels of quality assurance. You might say that anywhere that has physical activity, there must be a defibrillator on site. Any of our providers that provide mental health related support have to have a certain qualification, or there needs to be a certain insurance level. There's a piece of work that was done by Craig Lister around quality assurance and social prescribing, where they set out between 10, I think, and 12 different levels of quality assurance. I know that here in the Northwest, whenever they'd done a piece of work around MDTs and better connecting them with the community and voluntary sector, they asked the different providers to say, look, you know, these are the kind of key principles in terms of the quality assurance. Where are you at in this journey? Have you got this in place? If not, don't worry. Are you working towards it? And if you're not and you need a bit of help, let us know. So, you know, it's really up to the project to determine how far you want to go in quality assurance. If you want to go really, really far on it, we do have a document store ability so that you can put up maybe some qualifications, proof of insurance and things like that. But for a lot of people, they say, look, the quality assurance is really about the strength of the partnership. And the very fact that we have a good partnership with our community and voluntary sector is enough for us, because they've been doing this for years and years and years, and they've been supporting the most vulnerable in our community, and they've been there a lot of time when others haven't been. So sometimes people just say, look, it's great to have that real good connection with the community and voluntary sector, and that's enough for us. It's a partnership side of things. So in short, we will work with you and you determine how far you want to go with your quality assurance, but we can support you either way.
That's brilliant, Jennifer. And just on that, Nicholas Bibby Roberts from Salford Wellbeing Matters has actually said the quality assurance can be checked by the link worker or the SP programs, and that's actually what's happening in Salford at the minute. So thank you, Nicola, for responding to that as well.
one last wee thing there. So there is a hub management section on Elemental, and you can kind of set your criteria. You can put in, for example, first aid, basic food hygiene qualification, whatever. So you can kind of set that on your hub management part of Elemental.
Brilliant. Thanks very much, Jennifer. So just moving on then, I'd like to welcome Dawn Junk. As mentioned, Dawn is actually on annual leave this week, but she's thankfully came on to join us today and give us a bit of feedback about Elemental and Vision in Action. Dawn's team leader at Willow Tree HLC, who are partner with Salford Primary Care Together. So Dawn, it's over to you to give us a bit of background to Salford Primary Care Together and Willow Tree HLC.
Hi, I'm Dawn from Salford Primary Care Together, and I'm the team leader at the Willow Tree Healthy Living Centre. We have 3 practices within the business, and also a homeless service which is soon to be called the Inclusion Centre. Our GPs understand the value and importance of social prescribing. It's so much easier now to make the referrals within Vision, and it is only 3 clicks away. The patients, sorry, I got a bit of interference, and the patients have better access to the advice, expertise and support they need to be as independent as they can. And the GPs and healthcare professionals, their administration duties are reduced with the time it takes to place a referral.
And that's brilliant, Dawn. And Helen Foster, we put on a quotation there from Helen to say that you just said there that GPs are bought in, and there's actually 26 vision practices in Salford, and all of the GPs are bought in. As you say, it's reducing admin time, patients are better supported and have better access. Do you see something in terms with the vision integration? Is it going, as a team leader and as a practice manager, do you feel a bit more supported as well?
Yeah, we do, and also the other practice within our businesses are all signed up. I think there's one still to be signed up. We're just waiting because we're merging with another practice as well next week, so they'll come over to us as well, and then Elemental will be within their vision systems as well.
Fantastic. Dawn, that's brilliant. Thank you for giving us a bit of insight into what it's like working with Vision and Elemental.
Yeah, thanks.
So Jennifer, back to you. So how can this partnership benefit organisations? What are the key benefits?
Well, I suppose this is, it kind of goes back to that slide, that the one I mentioned at the start that I love, and it really, you know, fast forward 7 years from when Leanne and I kind of had first started out on this journey. We're now able to see that, you know, it is saving GPs time, it is saving MDTs time, multidisciplinary teams time in making and managing referrals. It's safer and more secure because it's all within the systems, and it stops people having to re-input the data side of things. We always have known that, you know, there are so many social determinants of health, and for a lot of GPs, they say, look, this gives me an opportunity to better support my patients, because, you know, medicine alone can't always, you know, do it. And they, you know, more than ever, GPs now are saying that, you know, they really value that community side of things and the social prescribing side of things. So it creates that, you know, link, and it makes that more sustainable, I suppose, as well. It's around the tracking and the measuring of the uptake and impact of the referral. So it really gives that 360 view side of things, and a lot of people like to be able to see that as well. A practice that I was chatting to recently, a social prescribing project, they said that a GP said, oh, we were chatting to the patients, and they said that, you know, I've phoned 4 times to see as that patient received a referral, and then the link workers were able to say, well, look, you know, here's on Elemental, we made a phone call on this day to the patient, we contacted them by letter on that day, and it really gives accountability as well, I think, as well for link workers and social prescribers to show, you know, all the effort that they go to, because we know there's so much involved in this. It's not just receiving a referral, having a conversation, and, you know, someone heading on their way. There's so much involved. and it really strengthens that relationship. We know that when health and community and local gov and housing are truly connected, it's great things happen. So it's really strengthening that relationship, especially between GPs and the community. And it's helping to demonstrate what's working well. All too often we focus on maybe the negative things, and sometimes you might see, if someone's describing a patient, they might say, oh, it's got had a stroke and hasn't been out recently and is struggling to keep up with the rehab program and is becoming depressed. But this gives you an opportunity to say, well, this person used to loves working with his hands, is really would love to get involved in some kind of men's sheds, likes being outside. It helps you to kind of really have a different viewpoint on things. And then you've got that reduction of avoidable GP appointments. So many people now have their data from social prescribing, and they can link that in with the GP data to say, of those 3,000 people that engaged in social prescribing, let's have a look. What was the appointment frequency like prior to social prescribing? What was it 3 months after, 6 months into it, 12 months further down the line? And this is where it gets really exciting, because you start to see the difference, because we all know it works. Sometimes when you see it like that, it really makes the case, and then there is no confusion in terms of should we or should we not.
Recommission evidence that everybody's talking about, Jennifer, isn't it? In terms of, whereas the evidence, does social prescribing work? Exactly. And as you say, we all know it works.
Exactly. So I know that we've got more questions, which is great. I love it when there's a bit of extra time at the end to go through, to take far more questions. But just before we move into those questions, as I said before, we're really, really happy to pick up with people and kind of explore with them in terms of, is this something that could work for you? What would be involved? Who do you need to get around the table? What are the costs that are involved, and what are the benefits associated with it? So we've put up a little next step slide here just to show kind of the way that we can, we've a little demo video that we can send you as well, that you can share maybe with some of the other decision makers. Have a chat, Paul. So Paul has cleared his diary tomorrow and Monday and Tuesday. So Paul Gaskell is going to be ready to take any one-to-one demos, any queries or anything like that. So we would love to hear more about what you guys are doing, and we're so delighted that you've taken the time, as I say, to come on and listen today. Hopefully it's been of help.
So just to say, if you kind of going around the houses or replying back via email, what I'm going to do now is launch a poll, and I want you to let us know if you'd like to hear more about Elemental, if you'd like us to send you this LinkedIn introduction video of the benefits for the main users, and then a longer demo overview of the main functions of Elemental. You can access that at any time and forward it on to anybody you think might be of interest. So we'll launch the poll now, and you might want to hear back from us. You might want to hear more. You might not be ready yet. That's completely fine, but you might just want to sign up to your newsletter. So we'll launch this poll. I won't be sharing the results because that's obviously private to you in terms of if you want us to contact you back. But what we can do then is we can pinpoint to everybody that said they wanted to hear back from us, and we'll be in touch, as I say, within the next few days. We'll send you out that link to the video, but if you want to have a bit of a deeper conversation, our head of partnerships, Paul Gaskell, as Jennifer mentioned, will be on site tomorrow and ready to speak to you. So we'll just let that run for a few more minutes. And then we'll move on to a few more questions before we finish up. So Jennifer, there's a question in there just while I'm letting the poll running from Sally Oakley. She's asking, how is the data for the organisations populated? And can we assume by organisation, Sally, do you mean providers? If you could just clarify that.
I'd say that's probably what Sally means. And that's probably one of our most popular questions. So that it can happen in a number of ways, Sally. So you might say that it's maybe the link workers that are going to populate that. So you might, when you're starting out your social prescribing project, you might say, look, well, here's the 5 or 10 that we're already working with. Let's involve this and them in social prescribing. Let's give them a login to Elemental, so they can actually upload their information themselves. We've designed that so simply. So it's literally a form that you put on the name of the intervention, the venue, the time, who delivers it, what domain it's part of, is there a cost, who's it ideally suited for. And once that's on there, as long as you've got that arrangement with the community provider that they're able to receive referrals, that's on there. And if there's any changes, maybe they decide that they're maybe closing down for a couple of weeks in the summer, that it can be updated then as well. Sometimes people have a static list of providers that they use, and some people sometimes even have like a database of services, like a website. So we can do that as well. But the link workers can populate a lot of that stuff. Then, as I say, you can give a login then to the community providers. A lot of them like to kind of be really involved in this, and they have. We can train them up as well to how to use Elemental. It's so simple for community providers. They can keep it updated. And then, as I say, if you had a kind of database of services, we can actually integrate with that as well. So we have an API that would connect in with other databases of services, and what that means is it's like a jigsaw, and it connects the two systems together. And it means that if you had volunteers updating your database of services, we could have a thing where it automatically pulls that information then into Elemental, so you don't have to double enter that information. Or you could have a combination of all of those things. So it really depends on your own project and what the kind of the lay of the land is, and the relationships that you have with your community partners, and what the capacity is as well for them to be able to receive the referrals, and agreeing on what information that you kind of want to be able to send to them and send back from them as well.
Thanks, Jennifer. Question from Joe there. Can GPs access the social prescribing database on Elemental directly too?
They can actually see it. They can't make a referral from it, but they can see. We have a little button down the left-hand side called the service locator, and you can press that and you can see the types of things that your patients are going to be introduced to. So it gives you that kind of, so whenever you're having a conversation with a patient and they're saying, I don't understand, what are you talking about? They could say, well, look, there's, from where we are now, within 2 miles, there's a walking group meeting up at B&Q's car park. There is swimming classes. There's, the gardening in the allotments, and there's the men's shed down in whatever street. So it lets you see what's available, and lets you kind of help the patient to understand the type of things. But no, it is all mainly done through the link worker. The link worker is that kind of linchpin in everything. Whatever you want to call that link worker, as I say, be it your community development or your social worker or whatever, community navigator.
Brilliant, Jennifer, thank you. We've got a few people asking about costs and flat fees per patient or per pathway, etc. Hopefully that slide that we've shown there in terms of finding out more information. We've also added Paul's email address there at the bottom. Certainly, we're more than happy to send you through some pricing if you'd like to get in touch. Alrighty, I'm just looking through these questions. So, a question here from Sebastian. How does your system show the impact of social prescribing on a reduction of GP appointments? And Jennifer, I think you touched on that in terms of at a practice level, looking at the reduction.
Yeah, the important thing there, Sebastian, is that kind of unique identifier. So because the NHS number is associated with a patient, and then you've got the social prescribing project coordinators. They have, and I always use this example of the 3,000, but you could have 3,000 patients and they have the 3,000 NHS numbers. You can link the data sets very easily then to be able to say, well, look, there's a great example actually in the northwest of England where they've done this, where they had the NHS number, and then that was able to be linked with the data that was on the GP practices to be able to say, okay, do a search here and find what was the frequency of appointments previous, and then what's it been engaging as well. We do have a little button on there too in terms of just frequent attender. So that's something where a GP knows that this person's maybe coming in a lot to see them in the practice, so they can press that button to be able to kind of say, look, this is where we might want to maybe look into what the kind of difference has been for this particular person. But it's where it's going is the linking of those data sets, which is really a lot of commissioners are really kind of excited about that side of things. And we've data sharing agreements in place with people as well to be able to do that. And that would only be done at the discretion of the social prescribing licensee, the manager. It's all agreed. We also have a kind of data extract as well, so that you can extract the data from Elemental And that's just a new function that we've made available, because a lot of people said, you know, we want us to be able to kind of get evaluators involved to really cut and slice this data in different ways. Whilst that we've made 6 or 7 really cool reports on Elemental, sometimes you've got, you know, statisticians who want to kind of go in further into the data. We've been able to make that available, and that's done but with yourselves, that if you were to have a license for Elemental, you would determine who has the ability to extract that data. So we would work with you on that as well. But that's just another example of how we listen and respond. You know, we're dynamic enough of an organization to really take feedback on, and I think if there's any customers on here, I would like to think that they would agree as well, that, you know, we really do listen, and all the changes that we've made to Elemental over the years have been driven by the customers and the people that use Elemental. So you see, when we demo it, you can see people's faces going, "Oh, that's brilliant, I love that," you know, and they kind of look at each other in the room. So we're looking forward to having a chat with you if you do want to follow up with us.
Brilliant, Jennifer, thank you. We've time for one more question there before we wrap up, from Joe. Does Elemental have a license to use patient activation measure? Usually there is a cost to using PAM via Insignia. Jennifer, would you like to answer that one?
Yeah. So thanks for that, Joe. Yeah, we have a partnership in the same way that we have a partnership with Vision. We have a partnership with Insignia as well. So as long as you have a license yourself for PAM licenses, we can then enable your link workers to be able to do an assessment, a PAM assessment on Elemental, and so that's just been made available recently. Now there is a slight cost associated with that, and it's a cost that that Insignia require. It's just an activation cost, but again, we can give you prices on that. But what it means is that whenever you go to your toolbar at the top and you can see your different measurement tools, patient activation measure is up there. You can do your PAM score assessment. It then populates the level and the score for the patient. And the next thing that we're doing, Joe, is that's in a not too distant future, we're going to be able to have a clinician can do a PAM score as well. And I know I sound really excited about this, but it's been something we've been working on. And you can set reminders as well. I know that a lot of people struggle sometimes to get that second PAM score. You can set a reminder as a link worker to say, look, 6 months time, follow up with this patient and do a PAM score again, and you can start to see that the really exciting bit in terms of what's the difference that has been made to this person's activation by being involved in social prescribing. But yeah, we can give you an outline of what that cost is as well, Joe.
Thanks, Jennifer. Well, I think that's us, folks. Thank you so much for joining us today. We're delighted to have you all have all your questions. As I said, we will follow up afterwards. If you would like to get in touch with us, feel free to do so, but we will pick up on anybody that answered that poll and said yes. That's all from me. Thank you, Jennifer, our co-founder and co-CEO of Elemental. Thank you to Lisa Holden, Vision Manager. And thank you to Dawn Junks. Would you like to say thanks, ladies, and bye?
Yes, thank you, everybody.
Thank you, everybody. Bye-bye.
Thank you, everybody. Thank you.
I want to give a wee shout out, a special thank you to Helen and our team who's been working away in the background helping us get prepared for today.
Thank you, Helen. And once again, thank you, everyone. We hope you have a lovely weekend, and hopefully the sun travels from Derry over to wherever you are. This webinar will be available via recording and will be sent out to you via email tomorrow. Thanks very much, everyone. Take care.
Thank you. Bye-bye.
Bye.